to another episode of Girls Talk. I am your host, Isatu and Bokum. Girls Talk is a show where we educate, analyze, and advocate for girl-related issues, and we table down possible solutions to these problems and make sure that the girls in our society are safe. Today I have with me Dr. Bittaye again. Dr. Bittaye was with us the last time discussing urinary tract infections, and today he's going to be talking to us about menstrual cycle, and the very big question is what's normal and what's not normal. Welcome to the show, Dr. Bittaye.
Oh, thank you very much for having me again.
You're welcome, Dr. Bittaye. Like I said, Dr. Bittaye was with us the last time and all of your questions were answered by him. So today your questions on menstruation again is going to be answered by Dr. Bittaye. So Dr. Bittaye, tell us an overview of menstruation like I always ask you.
Okay, so for the menstruation, it is usually what is seen when women reach the age where we can say that they are in the reproductive time.
Okay.
And it varies, from country to country or place to place. In Gambia, most people will see it around 13 and they will stop seeing it around 48.
Okay.
Yeah, so and the menstruation is about the ovulatory cycle. So it has phases. Menstruation, what you are seeing, when you see in the blood, it is just a phase in a cycle. A cycle that will usually lead to pregnancy, or if there is no pregnancy, then there is shedding. So the menstruation, you will come to know, differs from woman to woman.
Okay.
Some women will see it, some shorter, some longer. The interval between the first period to the next one also varies from woman to woman.
Okay.
Yeah,
So are there any symptoms and signs before a woman sees her menstruation, her menstrual period?
Yeah, that also, like for example, it varies. People have different manifestation.
Okay.
Yeah, some people, when they see their menses, it's very painful. We call it dysmenorrhea. Yeah, some of them, they will require excuse duty. They will not have to go to work because of the pain. They have severe pain when they are about to see their menses till they start. Some, what we call premenstrual syndrome. Some people, before they see their menses,
Yeah, I was going to come to that.
yeah, they have some symptoms that sometimes can be very bad.
Okay.
And usually it stops with the advent of the menses.
So what are some of these PMS, the premenstrual syndromes?
So this one comes in different forms. So some people, it can be, some psychological issues. Some people, it can be some somatic. They have some sensations or, so they have different, people vary. Okay. But the thing is that it usually comes before the menses, and soon when the menses starts, so then it stops.
So it's either ways?
Yeah, no,
ways, before and after?
It's different from dysmenorrhea. Dysmenorrhea usually commences or just before the menses starts. Let's say the day before, it can start. Maybe the first 2 days are painful, and then subsequent days will not be painful. But for premenstrual, it's let's say maybe 4 days or 5 days before you see your menses, and usually at the commencement of the menses, it will stop.
So the heavy and light flows, we have a lot of complaints about that. So some girls don't actually understand whether when they have heavy flow during their menstrual cycle, maybe they're infected with an infection or something. Is there any?
Oh, okay, so the normal for the menses, the duration of the flow is important.
Okay.
So you'll see in different literature. So let me just give you what is normal.
Okay.
So the literature, you will see 2 to 7 days is normal. If you see your menses, the flow, just some books will say 3 to 7, but generally it's around 5 days. 3 to 7, if you take it, is fine.
Okay.
That's normal. And also that's the number of days you flow. So the amount of meals, if you're able to measure the meal, usually it's less than 80 meals. Between the amount of blood that's coming. Yes, it's about between 40 to 80 meals, if you are able to quantify it. So this is usually considered normal. So the length of the cycle. So like if you start seeing your menses today, till the next time you are, including the days you bleed, because the Gambia, many people, if you tell them when was the last time you saw your menses, they tell you the last day they saw it.
Oh, that's not the last day you see your menses?
No. So when a doctor asks you when is your last menstrual period, you should give the first day of your bleeding.
Till the end.
No. Just like if I tell you, when was the last time you saw your menses? and you started bleeding 1st August and it stopped 5th August. Okay. You should tell me my last menstrual period was 1st August. Okay. But many people in Gambia will tell me 5th August. And that's not. So now if you take, for example, the day you started bleeding till the other day when you started bleeding again, including the time you bled and ultra and all that, till you're seen. So that interval, you know, now traditionally is accepted as 21 to 35 days. Okay. So it is normal for a woman to can see her menses twice in a month. If your cycle is 21 days, 21 days. You
can actually see it twice.
Yes, but but this is the problem. Most women think that they have to see it only once in a month. And like if you see it on the 1st, you bleed for 3 days, then you see it again on the 22nd. It's okay if your cycle is 21 days, every 21 days.
Okay. So what's the difference if your cycle is 28 days?
No, majority of the people have a 28-day cycle. Okay. So, but it doesn't mean that every woman must have 28-day cycle. There are people who have a 35-day cycle.
Oh, wow.
So that means that every 3 months they see twice. So they'll go a whole month, they will not see them. So every woman should know your cycle. You should know how long does it take you. Not every woman should be having 28-day cycle or 30-day cycle. So if you have a 28-day cycle or a 30-day cycle, that's the time when every month you will see once. Okay. Yeah, but if you have a 21-day cycle, you may see twice in a month. If you have a 35-day cycle or 34-day cycle, you will not see a whole month. You might skip a month and all that.
So,
and that's considered normal.
It's normal.
Yeah, up to that level. Normal? Now, if it is below that or above that, let's say you see every 19 days, or you see every 20 days, or you see every 15 days, that's not normal. If you see more than 35 days, like you see every 36 days, 37 days, it's not considered normal. Then we'll try to see what are the problems.
So to just break it down for our viewers, how can a girl monitor her cycle? Because they might not even know what's not normal and what's actually normal if they can't tell the duration of their cycle, if it's 28, if it is 35, like you said, right? And also, how can a girl monitor her cycle?
I think at least you should do it for 6 months. You should have a calendar. I think nowadays they have apps. So you just most of these guys, they have smartphones. So they can have an app where you put every time you see your menses, you put the 1st day. And when you stop bleeding, you put it there. And then when you see it again, it will be the 1st day. So, so then you'll be able to know your cycle. And this can be helpful if you come to the hospital and the doctors want to know anything, whether you're pregnant or not. And it can be helpful.
So what causes absent menstrual period? Because some girls, it's not even to skip a month. They skip a whole of 6-7 months. They do not see their menstruations. And at the end of that 6-7 months, their menstruation comes back. So is that an infection or it's just normal? So
the causes for not seeing your menses can be physiological. Okay. Maybe you are pregnant. So if you are pregnant, you'll not see your menses. Or if you are too young to start before the age of menarche, or sometimes you are old, like when you pass the stage, you will not see your menses. But yes, sometimes you can also have what we call oligomenorrhea or amenorrhea at all. So the causes for this varies, but one of them, for example, a very common one is polycystic ovarian syndrome. So where the woman may skip 3 months, 6 months, and will not see her menses, then suddenly will start to bleed heavily. Sometimes it may be because of hormonal problems. Some women just after some time, when you become too skinny, you lose weight till your BMI is less than 19 or less than 18. Because estrogen that is produced in the periphery will not be produced because the fat. So sometimes you can miss your period.
So it's actually advisable for these girls to see a doctor to be sure of what the problem is?
Yes. If you are not seeing your menses for some reason, it's just good to have the diagnosis. Sometimes if it is polycystic ovary and you are not ready to have a child, we'll say, don't worry, this condition is okay. When you get married and you want to have a child, we can help you easily, But meanwhile, nothing to worry about. We may just give you some periodic contraception so that to reduce, the risk of hyperplasia. But otherwise, it's not something to worry about. So if we know, if you have anything like about your menses that's worrying you, it's good to go to someone like a doctor, and they will clarify it for you. Sometimes nothing bad, and sometimes maybe you need treatment from then onwards. Some people, it will take them they will never see their menses since they are born.
fertility? Does that mean they're infertile? Because sometimes they're like, if you don't see your menstruation, you're never gonna have a child. That's the belief. It's that actually.
So you know, like I can't just give a direct answer. So it will depend on the cause. Okay. You know, for what is called, some people they see their menses every month, but they are not seeing it outside. They are not seeing.
I don't understand.
Okay, you know, seeing your menses is a process that is like you slough off the endometrium. Yeah. So some women, that process is happening, but
they don't see blood.
They don't see blood. Maybe it goes backwards. Or maybe there's a membrane that is stopping the blood from coming out. So every month you are seeing your menses, but blood is not coming out. So because you have a membrane. Some people, like their hymen is totally closed. It doesn't have any hole to allow, for example, the blood to pass. So you'll be seeing your menses, the blood will be accumulating inside there in the vagina, but you will not be seeing anything out. But every month you are seeing.
So is that a problem? Because we are always told that when you menstruate, you're taking the bad blood or something out of your body. Yeah. So if you're supposed to accumulate that.
You see, this is a good question you've asked, because many people say that. You see, some of the contraception, for example, we give women, when we give it to them, the side effect is that you don't see your menses sometimes. Okay. And most women will tell me that, oh, I have to see my menses because this blood is accumulating inside. So they don't understand that, like some of the contraception, the way it works is that it causes atrophy. Okay. It causes the endometrium that was supposed to grow and slow off. It stops it from growing. Right. So then you will not see your menses. The menses that you see is because the endometrium becomes big. The endometrium, the lining of the womb, the sponge that will receive the baby so that the baby can lie nicely and all that. Every month it is prepared. So if for some reason you don't get pregnant, it sloughs off so that you prepare another bed for the baby. So sometimes the drugs that we give for contraception doesn't allow the bed to grow, you know. So because of that, you don't see your menses. It's not that it is accumulating there. But in this case, like where you have the membrane or something, yes, blood is accumulating, and it's a simple surgery we need to do, and then like 10-minute surgery, and then you're fine. If it is just the hymen. You know, some women are born without hymen. Yes. Some are born with different types of hymen. Some people, their hymen is totally closed. So it doesn't have any blood. So those people, they will never see their menses. So from birth till they reach 19, they will not see their menses until you do the operation, because the menses is coming, but it's still accumulating inside. It's not a big problem. So that's why if you're not seeing your menses from birth, you go to. But sometimes, you know, it is big issue. It may sometimes, like those type of women may be able to get kids, but there are some women who maybe they don't have the ovaries, or genetically they are men, but you know, phenotypically they are females and all that. So those ones will not be able to have kids. But if you go to the hospital, we'll be able to tell you. So if you reach, let's say 13, and you've not started breast development, you know, or you reach 15 and you've not seen your menses and all that, maybe it will be good, you know, to see a doctor and see what the problem is.
So I just want to maybe divert a little bit from the topic. I'm looking at contraceptives. You mentioned it earlier when talking about the menstruation. So there are some girls actually, when they are on contraceptive pills, they either do not see menstruation at all, or maybe they see some kind of blood stains. Is that considered your menstrual cycle?
That's a difficult one. See, the problem is that for the concept of the menses is different from withdrawal bleed. Okay. When you are using contraception, the bleeding you have is not menses. It's withdrawal bleed. You know, so if somebody is on contraception, when the time that you reach the different pills, if it is the combined pill, you know, you have a withdrawal bleed, then you start again. So sometimes if we are on the progesterone base, like the one they give you, the depot and all that, so one of the side effects is that you tend to have irregular bleeding. So your bleeding can, you know, so some women, when they're given that, they may go 2 months, 3 months, they will not see their menses. Then they can spot for 2 weeks, 3 weeks, but it's all expected. So before we give it to you, we explain all that to you.
And that spotting is not a problem?
It's not a problem. It's only the men who is, no, that's for the married people, not girls talk. But as a doctor, like the men complain a lot. The married people, when they come to us to get the contraception, and they bleed a lot. 21 days they are spotted. You know, it's the men who will come and complain. Doctor, you have to change this one. This one is bleeding a lot.
Why is this not really a problem?
Huh?
So how can menstrual problems be diagnosed?
Yes, that's a good one. So so first, if you identify any abnormality, you go see the doctor. They will take a history, and that will be very nice if you've had a calendar. So if the woman comes to the doctor with a history of her menses, you know, this is when I started this. So the doctor will study it and will ask you questions. And sometimes if we need to do, you know, some imaging scanning and all that, we'll do it to see whether it is a membrane problem, whether you are menstruating but it's not coming out. Sometimes we have to do blood tests to check your ovaries, your hormones, whether the hormones are in good state, and whether you're supposed to see, or if the hormones have a problem, which one has a problem.
So finally, let's just digress on the cleanliness during menstruation, because some girls do not actually know the regularity of changing their pads or maybe cleaning themselves and all that. So I don't know, you're a man, but you're a gynecologist. So I just want you to tell us in the medical aspect, what advice would you give to the girls out there when they're on their period, what exactly they're supposed to be doing and what they're not supposed to be doing?
Oh, I know hygiene generally is very important.
Yes.
And I don't envisage someone to use one pad just because it's not soaked for the whole day. So you should frequently change the pad. But my medical advice would be, don't use like tampons. Okay. Don't use the ones that, they are very comfortable, I think, for women, but it's not good. It's not good. Yeah, the one that you put inside the vagina, deep there, so that, and you leave it there. So I recommend that you use the one that we just plate on the vulva. Okay. Yeah, and the ones that it should not be very warm. Nowadays, people are making these small ones. Maybe they are good, I don't know, but you have to change it frequently. Okay. Yeah, so for us, we used to like the Freedom. I'm not sure whether that's. I think might be an old one.
Is it the blue pack?
Yeah, it's a big one.
I think it's still available.
Yeah, but it's very big
and
but
some
maybe
girls
not.
run away from that. They prefer to use something they call Bella. It's actually very light and flat.
Yeah, I know. So that other one is big and may deform with the people what they are putting on that. You know, people, if you want to put on a tight thing, it might just show. Yeah. So, but for now, even if because that one can choke a lot. Okay. The other one, but now I know parts are expensive, and I think I don't know your foundation or what is, but you should encourage women to use the parts, not to use the cloths and all that. No. So, but I know parts are expensive, and there should be NGOs out there to help women who cannot afford parts to give it to them.
There was this time I was online and I saw someone sewing pad that is using some kind of a sponge and using this wax material to sew it in the form of a pad, and was like they're trying to be, I don't know, they're trying to cut cost.
I mean, if it works,
does that really work?
I don't know that, but I've not seen it. But if it works and you are using local material and it's soaking it very well, I mean, you should encourage it. If it works, if it is working, like just the pad and it's soaking very well and it won't cause any irritation, then it becomes cheaper. Because there are many girls who are out there and they use cloths and all that. And I think people should try to help them.
So Dr. Bittaye, your final words before we close this episode?
Oh, just to say thank you very much for inviting us once again, and then to say to all women out there and girls that they should do their best if they have any issues to go to hospitals or to ask their science lecturers, science teachers in the primary schools, and the mothers, they should talk to their kids before they have menses. Sometimes these kids, they are unaware the first time it happens, and they are so scared and all that. So there should be some education. It's a very sensitive topic. Some women don't want to talk to their kids about sex early and all this maturation and all that, so that it might be in their minds. But I think it's a good thing if you can do it before they see it, so that they are not caught unawares.
Thank you so much, Dr. Bittaye. I think that was our second topic on the Girls Talk Show about sexuality, whether we should encourage parents to talk to their girl child about sex even before they get to that particular age. So your advice is well heard, and thank you so much for watching this episode of Girls Talk. Thank you, Dr. Bittaye, for joining us. And make sure you like, subscribe to our YouTube channel, and also follow our Facebook page for more updates about the show. I have been your host, Isatu and Bokum.